The question first is why? Why perform fat grafting if we're going to do it, and what are the indications? And so what we're going to talk today is a little bit more about philosophy of when to do the procedure, when not to. So if we look at the aging of the face, there's definitely a component of volumetric loss. If you look at the brows and argue that that is a gravitational component, you see that actually if you measure the brow position, it's about the same. And even the skin on the right is down a little bit, but it's actually retracted upwards on the left. So areas that may be obviously gravitational may actually not be obviously gravitational if we look at it from a volume perspective. And I would argue that we're losing more soft tissue than we are bone. Let's take a narrower time frame, from the early to late 30s, and look very carefully at that. If we argue that's gravity, if we look again, we're seeing more skeletonization of the brow, the anterior cheek, and even around the mouth area. And I think that's the principal concern of aging that I see as far as volumetric loss. So the way that I try to teach my patients of how I see aging, it's like a glass of water that empties. And that emptying process is the principal mechanism from our 30s onward of the aging process. So is fat permanent? Well, I really believe it is. The difference is someone comes back to you 5 or 10 years later, are they looking older? Of course they are. Why? Because what's happening is if you fill up the glass of water to a certain ideal, sometimes women think that in their early 20s they can actually have too much fat. And as it continues to age, you just lose a little bit every year. So it's easy to come back and top that off. But it is permanent if done well. So here's a linear model of aging just from a position of volume where we just lose soft tissue volume. And that's how I really try to have my patients understand the aging process. The idea here is that our face has two components, soft and hard tissue. We do lose both. I think that we actually lose a lot more soft tissue than hard tissue. And there was a recent article that I read. It was very interesting in showing that skulls in older individuals show a lot of bony loss. But I think in the era today of better dentition, if we maintain dentition, we actually lose a lot less hard tissue than we usually do. And I would argue that from our 30s onward, the principal aging is in our soft tissue. So let's take a look at how I see aging. It's a combination of soft and hard tissue loss. Obviously there's gravity, obviously there's skin changes, but we're focused today simply on volume. So if we're losing more soft tissue vis-a-vis hard tissue, then the question is, what should we do? Should we put an implant in? I argue that if you put the implant in, what happens is the implant becomes more visible because you have a lot of the difference between the soft tissue to hard tissue interface becomes narrower. You actually accentuate the hard tissues and you don't have as much soft tissue envelope to support that implant. The aging process we go back to again is a greater degree of soft tissue loss, in my opinion, vis-a-vis hard tissue loss. And let's compare that if we do a fat graft. What happens is we bring back the relationship of youth, which is a greater degree of covering of the hard tissue component as we age, and I think it helps mimic youthfulness a little bit better. So if we return to that photograph we had early on and look at it from a soft tissue versus hard tissue loss, I think there's no question there's a greater component in our 30s and 40s of soft tissue loss vis-a-vis hard tissue loss. So what is the other thing that's so important with aging? How do we recognize a face to be older? In the course that we're going to be talking in at 3 o'clock, we're going to talk about facial shape, but another component is facial transitions. So the idea is that we have more and more transitions across our face from the malar ligament, the tear trough, nasojugal groove, the brow exposure, the lower buccal zones, anterior chin, and pre-jowl sulcus. So what I find oftentimes, if we use conservative implants, we can actually accentuate transitions. And fat grafting, I think we can limit transitions, obviously unless we put a lot of implants in. But if we just sort of think about the conventional implants that we would put in, not a tear trough implant, a buccal implant, a submalar implant, just a cheek or a chin implant, we oftentimes tend to accentuate, or we can accentuate, that difference of soft tissue loss vis-a-vis hard tissue loss and actually increase transitions of the face. So here's an example of a 53-year-old lady 2 years out after a single session of fat grafting, and if you look, she really has a tremendous degree of fat loss vis-a-vis bone loss, and there's an exposure of the bony component that has been restored with fat transfer. a year and a half of fat graft. These are all one-session fat transfers. And you're seeing that the skin is changing from the Botox, but you're also seeing that there's a tremendous degree of bone exposure as we get into our 50s that I think can be accentuated more with a hard implant versus soft. So when do I not do fat transfer? Is it the panacea for all conditions? The answer is no. There are some major limitations, and we've got to figure out what those are. Are implants justified? Well, we first have to understand what is a fat graft to have that answer a little bit clearer in your mind. I don't look at fat like Restylane. It's not a bioinert substance put into the face. It is a live graft. If it's done well, it will survive and it will thrive, and it'll be there forever. The person gains weight, there's a risk because it is a live graft. And so if it is a permanent graft, we have to understand the risk behind that. So first of all, let's talk about the nature of a graft. Initially, for the first 1 or 2 weeks, there's a lot of swelling. There's a tremendous degree of edema. And as you get into the 3rd or 4th week, oftentimes the patient actually looks better because the skin is stretched out, they look really good, and they think, boy, this is it. But you've got to inform the patient at about the 3 to 4 month juncture. I think there's oftentimes a loss of volume, and we don't know exactly why, but I think the fat cells shrink a little bit before the blood supply matures. And if you look at a patient with a good fat transfer, over a period of about 6 months to 18 months, there's ongoing improvement. And I'm actually very rigorous in my photographic documentation to follow that. And so this is, and then the reason there's a little bit further dip at the end is that people get older. That glass of water idea, that they continue to lose just a little bit. So this is a lady at a week. Pretty swollen, slightly bruised, a little bit unnatural. And if you follow her over a period of time, this is a month out, still a bit puffy, a little bit too big in the cheek, but clearly rejuvenated. And if we move forward in time, there's maybe ideal, maybe not, but it's definitely shrunk, and you're thinking, well, that's a minimal survival. And I can't really quantify percentage survival. I just know how much fat I put in will result in what kind of result at about a year to year and a half. We'll talk about more of that in our next conference coming up at 3. This is 6 months out, and I think there is a dip. There's something that you probably would, if you just gave up at this point, would say, well, she's going downhill. But if you follow her at 11 months, it's getting better, and at 15 months or so, there's even more volume. And this is a static weight. There's no weight change, but this is just to understand that evolution. If you really follow your results and you get viable fat, it is permanent. So I like the idea of like replacing like. Is fat always indicated? Well, I think the aging phase, where the principal consideration is soft tissue loss, I think that the fat graft works very well in my hands. And when we're talking about bony replacement, this is a medium conform chin implant with a little bit of neck lipo. There's no way that I would put fat in that chin. It just would look fat, and it's unpredictable in terms of projection. And you can see that, I think, in this situation with microgenia, it just makes a lot more sense to put a hard implant in. A little promo for my hair course in St. Louis coming up in July. It's a great course. And if there's any questions, you can email me, or we have a little time for Q&A at the end.